Kristen Skovira is here now talking about breast cancer. And Kristen, for many patients, choosing how to fight this disease is really tough and it's kind of confusing.
So true. And women are having even preventative double mastectomies at times to stay one step ahead of this deadly disease. But today I spoke with a Denver doctor who's now working with a new type of radiation therapy. It's far less invasive and it's a first of its kind here in Colorado. Pam McCants can't help but hug this machine. The 50-year-old Coloradan says she was at her annual physical, years overdue, for a mammogram.
My doctor was like, "When's the last time you had a mammogram?" And I'm like, "I don't know." He's like, "Go. You go now."
She did and got the news nobody wants to hear.
It was calcification is what they called it. So it was pre-cancer.
Pre-cancer that needed to be treated with radiation, also known as brachytherapy, a form of radiation therapy where a radioisotope is placed inside the tumor to deliver an intense dose.
One of the drawbacks of that is a woman having to decide whether to have tubes or a radioisotope placed in her breast.
That's Dr. David Schreiber, CEO of Littleton Radiation and Oncology, and the first in Colorado to use a new technology called AccuBoost therapy.
Allows the same advantages of brachytherapy, that is quick treatment, localized treatment, excellent cosmetic results and cure rates, but we remove the invasive part of the procedure.
He said, "I'm getting this machine." He said, "Would you like to be my first patient?" And I said, "Absolutely."
The treatment is very similar to a typical mammogram.
We attack the breast from several different directions, so each individual angle that shoots the radiation gives very little radiation, but where all the beams come together in the center, the doses add up to give a high dose of radiation, thus sparing the tissue in between the skin and the tumor.
And in the case of Pam, possibly sparing her life.
I just had a mammogram a few days ago, actually, and no sign of change. No, nothing, everything looks good.
That's really good news. Now, in comparison to standard radiation therapy, this costs about half as much, so that's something to think about. And Pam told me she experienced much less in the way of side effects. She said she just pretty much had the treatment and went on living her life.
So how many would you need?
Yeah, she said she did about 8 to 10, and that's about typical for this. And then you have to stay in that position, though, for about an hour. So, but she said, the comparison and what you'd have to do with the invasive stuff, she said she'd rather sit there. She listened to music. She said the staff is wonderful.
Right,
yeah.
and it's worth having another option.
Exactly.
Thanks, Kristen.